and saying hi. So hi everyone. So excited to be here with Lisa. I just want to briefly introduce myself and what we're here doing today. So my name is Lauren. I'm an oncology social worker at CancerCare, as well as CancerCare's Women and Children's Program Manager. I work very closely with the Tmbc Foundation as we have partnered together. CancerCare and the Tmbc Foundation have partnered together to offer specialized support services to people impacted by TNBC. And we have Lisa here with us, which is awesome, part of the TNBC community. And today is Triple Negative Breast Cancer Day. So that is why we wanted to come together on this day. So very excited to be here. And just to share a little bit about Triple Negative Breast Cancer Day, this is the only global event dedicated to raising funds and awareness for TNBC. So a very special day. And, with that, let's, get started. Lisa and I will be talking a little bit about her story as well as her involvement in the TNBC Foundation and, kind of what's been helpful for her throughout her experience. So with that, I will turn it over to Lisa, and thank you for joining me and looking forward to our conversation today.
Thank you for having me, and hello everybody. Nice to be here and chat. So a little about myself. In 2018, at the age of 38, I was diagnosed with bilateral breast cancer. So that in itself was but the thing was I was diagnosed with two separate primary breast cancers. So I did have estrogen-fed breast cancer on my left side, but triple negative on my right side, and it is the triple negative breast cancer which had metastasized to my liver and a couple of lymph nodes as well.
Okay, all right. Well, thank you for sharing that. And just, if you could explain a little bit further. So you were diagnosed with metastatic triple negative breast cancer at the start, is that correct?
That's right.
Okay.
Right out of the gate. It wasn't one of those cases where I could do a lumpectomy and maybe some radiation and take care of things. Unfortunately, when I was diagnosed, it had already spread to an incurable point.
Okay. Yeah, and what was the diagnosis process like for you? How did you find out that you had TNBC?
I found the lump myself.
Okay.
And sadly enough, it was excused for a cyst because of my age for quite a few months. So I definitely pushed on and pressured our medical system here and asked that it be biopsied because I just wasn't comfortable leaving it. It felt hard. It was very sore. It was hot to the touch. And physically you could actually see it bulging. So I did go to a cancer center, and they did do a biopsy where it was diagnosed there.
Okay. Yeah, that can, that's such a challenging process. And, it sounds like you really advocated for yourself during that time. Yeah, really hard.
You really have to advocate for yourself. You're your number one cheerleader. That's what I always say. Nobody's cheering for you as hard as you're cheering for yourself.
Absolutely. Definitely. And what was treatment like for you? Did you begin some type of treatment right away?
I was actually lucky to have a great oncologist because of my age who recommended having egg retrieval beforehand.
Okay.
Because a lot of young women just don't get that opportunity. They're rushed right into chemo, and then chances for maybe family later might be squished a little. So I did about 3 weeks of hormone treatment and IVF treatment to retrieve some eggs and put those on ice. And then I started my treatment right after. Literally the day I removed the eggs, I started treatment right away.
Wow.
Mm-hmm.
What was that process like for you? I know that, we hear a lot about, fertility preservation and that process and making sure to have that conversation with your medical team ahead of time. How was that approach for you?
For me, we had actually been trying to have a second child when
Okay.
I was diagnosed. So that was, for some reason, that was first and foremost
Of
in the
course.
front of my mind.
Yeah, definitely.
And I think I was kind of still in shock mode. I was still like, yeah, we're having more babies, absolutely.
Mm-hmm.
And kind of dismissed the whole diagnosis and focused on the fertility part for the first
Sure.
3 weeks.
Yeah. Yeah, absolutely. And then once you finished that process, you said you started was it right into chemotherapy, you said? Or radiation?
Right into chemotherapy. Absolutely.
Okay. And how did your experience with chemo go overall? Did it last a while, or what did that look like for you?
Yeah, I started chemo in September of 2018. Chemo for me did not end until January of 2019.
Okay.
So it was a fairly lengthy IV chemo.
Mm-hmm.
I didn't know what to really expect at first. Obviously, the first thing you expect is to lose your hair. It's broadcasted everywhere. You're going to lose your hair.
Yeah.
And my oncologist said to me, I guarantee you 14 to 17 days after your first infusion, it'll fall out. So on day 14, I was going, ooh, I'm lucky. It's not going
Yeah.
anywhere.
Yeah.
And, and that night, I literally put my fingers through my hair
Mm.
and just gobs and gobs came out. And I have to say, through the whole chemo experience, I feel like the hair loss was probably the most traumatic part because as a female, you identify with your hair so much.
Of course. Yeah, and for others, experiencing that hair loss or, maybe approaching that, maybe now aware that their treatment may impact or may cause hair loss. Do you have any suggestions, for them as far as hair loss?
My suggestion would be start cutting it short beforehand so it's not as triggering when it does start to come out.
Okay.
That way you're not looking at it on your pillow when you wake up.
Mm-hmm.
The other thing I also did was I slept with a bonnet or a cap, like a bamboo cap on,
Oh.
so that when the hair follicles did release, it was caught in the cap. I didn't have to look at it on the bed, and it was just better for my mental health that way.
Mm-hmm. Yeah, that's a great point. I know I hear of a lot of women, waking up and seeing that, and that's, such a, like a physical attribute, and to see that it's very triggering and traumatic.
Yeah.
We have a couple of comments coming in. Someone mentioned that they cut it also when they were diagnosed, and then mentioned here about cold capping. Had that come up for you at all? Cold capping?
My oncologist actually did not recommend it,
Okay.
only because obviously the cold, is how she explained it to me, was the cold is going to constrict blood vessels.
Mm-hmm.
And if blood vessels are constricted, chemo's having a harder time getting through.
Mm-hmm.
So she said to me, if you want the best bang for your buck, don't cold cap your head. It's going to grow back. Let the chemo do its job and let it get through all the blood vessels through your system.
Yeah. Okay. Yeah. And of course, we always recommend for everyone to speak back with their oncologist, their
Absolutely.
medical team, and a quick disclaimer and note that this program does not include any specific medical advice. We're not medical professionals and not offering that today. So we always recommend go back to your healthcare provider with any questions, concerns, anything whatsoever. Yeah, so just wanted to note that. But yeah, that's it. Yeah, it's really helpful to hear of your experience with hair loss and, just going through that. And I think that's a great point. Maybe cutting it, as that it may happen, and just to start that period of adjustment.
Yeah.
Absolutely. And
It's kind of a,
yeah.
sorry, it's kind of a
No.
great time too if you've had really long hair and you
Mm-hmm.
always wanted to kind of experiment with short
Sure.
hair,
Yeah.
you know, like every week until, or every day until it starts to fall out, maybe cut it a little shorter, just
Mm-hmm.
experiment a little bit. That way, when it grows in, you're going to know, hey, maybe I do like it short.
Yeah, of course. And did your hair grow in differently when it came back? Yeah.
100%. So I had dark brown, black hair down way past my shoulders prior to chemo. And when it grew in, it came in all silver gray
Wow.
and curly.
Yeah, I have heard the curly, for people that it just totally different, maybe texture, something
Yep.
different all around. Wow, that must have been surprising also.
Absolutely. And at first, of course, we all joked and we're like, oh, look, she looks like Annie Lennox. And right. And then after a while, you're kind of like, well, I kind of miss my old hair. So you play with it, but it grows back and you just have fun with it when it does. So
Yeah, yeah, definitely. And during that period of hair loss, do you recommend, anything? I don't know, some women prefer, or some people may prefer like wigs or scarves or hats. Any
Mhm.
of those come up for you or any preference?
Yeah, I think it's definitely a personal preference. I did, for sure. I purchased a couple of wigs because, losing your hair the first time, it was fairly traumatic. And then after wearing said wigs a few times, I was kind of over it. I thought, they're a little bit hot, they're a little itchy.
Mm-hmm.
And I just went with bamboo caps. They were breathable, they kept my head warm. I
Yeah.
could wear them to sleep. A lot of people don't realize you lose so much heat through your head when you're sleeping, so it does keep you warmer.
Okay. Yeah, that's a great suggestion. Okay. And then just going on with, what you had mentioned about treatment. So you were going through chemotherapy and then you went through radiation after that.
That's right, yeah.
Okay.
So I did, in total, I'm just trying to think here, 15, 19 chemo infusions is altogether is what I had between September and January.
Sure.
And then we had a couple of months, about 8 weeks of healing from the chemo. We wanted to make sure that my hemoglobin was up, and of course my white blood cells and my neutrophils, and I was starting to bounce back from the chemo before we went into radiation.
Mm-hmm.
So radiation started in the spring and didn't end until July of 2019.
Okay. All right. And how is the experience of radiation for you? Were you getting it in different areas? What was that like?
Mhm. So I was really lucky to have an oncologist that went for curative intent, even though they technically say I'm incurable. Because I had so few metastases, they were still going to go with intent to cure. Having said that, I was given a radiation called stereotactic radiation. It's very pinpoint, directly on the tumor site itself, so it has a higher success rate. I did do, they called IMRT. It's a little bit more broad,
Mm-hmm.
but I did have that on my chest for the lymph nodes in my chest.
Okay.
And then I had the stereotactic radiation on my liver for the one spot that did not resolve with the chemo.
Okay.
And then after I was done all that, I had whole breast radiation. So it's driving every day to the hospital for a treatment that only takes maybe 10 minutes. So
Yeah.
the exhaustion part comes from the radiation, but it's the mental exhaustion part that comes from driving 2 hours to your clinic for a 10-minute treatment.
Absolutely. That's definitely a challenge that, I hear as well, transportation to and from, of course, the cost of that, the exhaustion of that.
Yeah,
It can be, so it can take such a toll, of course. And for that to be
absolutely.
every day, and you went every day for a certain number of weeks, So,
Yeah, the first amount of chemo was every day for 15 days. When we moved on to the liver, it was every day for 3 days, and then when we moved on to the whole breast, it was every day for 33 days.
okay.
So it's quite extensive. I was super blessed to have an amazing group of family and friends. This is pre-COVID when people could come with you. Uh, and I actually had a different person go with me to radiation every day.
Wow, that's amazing.
Yeah.
What an awesome support team.
Yeah, they were phenomenal.
Yeah. Awesome.
Yeah.
That's great. That's great to hear. And for radiation, any side effects or any suggestions for others that are beginning radiation?
For sure. My personal suggestion would be stay ahead of the burn. Whatever your oncologist recommends for a moisturizer, if you can slather it on 3 times a day, just really moisturize the heck out of the area that you're getting radiated because it's accumulative. You don't realize how much you're burning until the end. My liver area, because I only had 3 shots of radiation for that, I didn't really see any discoloration.
Okay.
But in my breast area and armpit area, where I had 33 radiation treatments, it was significantly darker. So I used Glaxo-based cream, was awesome. It does smell very medicinal, very institutional, but it's very thick. It works amazing, and I was super lucky not to have any blisters at all.
Okay, that's great. And now that it has been some time since radiation, any like long lasting effects like on your skin or anything like that that has come up for you?
Yeah, I mean, aside from a lot of people don't realize you have little black tattoo dots on your skin. So that's like lifelong. That's there to stay unless you have them laser removed.
Okay.
And my skin under the armpit area, which is obviously a thinner skin, a more sensitive skin, is definitely discolored. It's a little darker. It kind of looks like I'm wearing a tanned bandeau all the time.
Yeah. Okay, that's definitely good for, everyone to hear and good to know. I think we think about, preparing for these treatments and what that may look like while you're receiving them, but I think, we get a lot of questions of what that looks like after the fact,
Yeah.
and how that can impact people. And in regards to the chemotherapy, any like later after the facts, like side effects or anything that you remember?
Yeah, the only thing, I've got a few kind of residual things that are kind of hanging on. We call it, a lot of people call it chemo brain, but your cognitive ability is a little bit lagging sometimes after chemo.
Yeah.
So I definitely work on my cognitive skills, whether it be through mind puzzles or, things like that, just to kind of keep sharp. The other thing I noticed was, oh, I can't think of the word now. Holy jumpins. In my fingers and toes, neuropathy. There it is.
Yeah.
There's your chemo brain for a perfect example. You're thinking and it just doesn't come to you.
Yeah.
Yeah. So I did have some neuropathy in my fingers and toes. For the most part, I'd say it's gone, except for a couple of nails that still every once in a while you can definitely feel the neuropathy. It feels like if you've slept on your arm and you get those pins and needle kind of feelings.
Falling asleep and that.
Yeah.
First, yeah.
That's the best way I can describe it anyway.
Yeah. And someone just commented here that radiation also changed the density it says radiation changed the density of my breast, more firmer. Okay, yeah, thank you for sharing.
Absolutely.
And also do want to mention that if anyone has any questions throughout and comments, please keep on sharing, and we'll try to read as we go and answer anything that we can.
For sure.
Okay, well, Lisa, thank you for sharing all that with us. And I just want to shift gears a little bit into your connection with the Triple Negative Breast Cancer Foundation. How did you find them, and kind of what led you to the foundation, or even when along your journey?
Yeah, when I first started my journey with Tnbc,
Mm-hmm.
of course, like everybody, you do the worst thing you possibly can do and go on Dr. Google. I don't recommend that. Don't do that. Um, but I definitely hooked up with a lot of amazing, strong, beautiful men and women
Mm-hmm.
who were part of the foundation. And they said, you know what? If you want to join a foundation that is uplifting
Mm-hmm.
and people are on the same wavelength as you, this is the place to go. So Kelly, she knows who she is, introduced me, and she has been a phenomenal inspiration, and that's how I got hooked up with them.
Awesome. And speaking of inspiration, someone just wrote, Lisa, you are an inspiration.
Aw, thank you.
Thank you. Well, that's great. Let's see. Someone else just wrote, so true about neuropathy in hands and feet, feeling restless. Sure.
Yeah.
Yeah. And do
Yeah.
you still, I'm sorry, Lisa, did you say you still experience that neuropathy even like today, or was it a little bit closer to?
Yeah, not so much in my feet as much anymore. But in my just actually in my fingernails, oddly enough. They start to lift a little bit with the neuropathy, and the nerve endings kind of, it's one of those ones where you go, oh, and you're like, geez, like that's really irritating. It's not necessarily super painful for me. But for me, the only way I can describe it is like nails on a chalkboard. It just irritates the heck out of me.
No, definitely. Definitely. I can imagine.
hmm
Okay, awesome. Yeah, and I'm so glad that you have, been connected with the TNBC Foundation. They do amazing work, and as from CancerCare, we're so glad to be connected with them as well. And just going into a couple more questions that we were going to speak about. What is something that maybe you wish you had known before being diagnosed with TNBC?
I wish that I had somebody there in the background saying, you know what, you are not a statistic. That's the big one.
Yeah.
Because when you're diagnosed stage 4 right out of the gate, obviously mentally you're just shocked. You're absolutely shell shocked. And the first thing you think is, okay, when am I going to die? What's my timeline? So a lot of people ask those questions, and my personal preference now is to not ask those questions.
Okay.
It's to try and live in the moment as much as you can. Some days that's harder than others.
Of course.
Because I've already passed my expiration date. So don't I guess my personal suggestion would be stay off Dr. Google, and I wish I would have known how many amazing thrivers are out there and living with metastatic triple negative breast cancer beyond the 22 months that you see in the media so often. There are thrivers and outliers out there, 5, 10, 15, some of them 20 years. So I wish I would have been told those things.
Definitely. I think, that's so important to think about and to consider, and everyone's, diagnosis, and, every person is different, and, every diagnosis and everyone's, path is, unique to them. So it's hard to, rely, as you said, rely on that statistic, or, Googling this information. You just don't know. That may not be specific to you. Absolutely.
And I mean, it's all going to, if you have breast cancer and it's triple negative, there's even variants of that. Maybe you have the Brca mutation, which is what I have. I have the Brca2 mutation. So that's going to change your treatment as well.
Yeah, absolutely. And we had someone just wrote, thanks for saying this. Those statistics really get me at times. Definitely.
Yeah,
I can understand that.
Don't read the statistics. And a lot of the time, those statistics are old. They're outdated. Yeah. So don't read the statistics. It's not good for your It's not good for up here.
Yeah, great point. And I know you mentioned the Brca BRCA mutation.
Mhm.
Do you mind sharing a little bit about that and finding out that you had the mutation, like, getting tested
Mhm.
for that, and what that was like for you?
Yeah, we had a very strong family history of breast cancer on my dad's side. So when we went in, that is the first thing I told them. I said, listen, we have a very, very strong history of breast cancer, and I'd like to get, tested for any sort of genetic mutations that may help my treatment along the way later on. So that is what they did. I was tested for 17 different mutations and just came back the one, which it turns out my younger cousin on my dad's side carried the same mutation. She also had breast cancer, and which ultimately my grandmother passed of.
Okay. I'm so sorry to hear that.
Mm-hmm.
And just a question that came in, I just want to address it before before I lose it here. What type of testing do you continue to have?
I'm being monitored via scan. So I was going every 3 months, and I've graduated now to every 6 months. And if people don't know what that means in graduating, it basically means right now my health is stable enough and everything's kind of chilling and sleeping that my oncologist feels that we can space out the scans to 6 months now, and I'm also being followed. My blood markers are being followed as well.
Okay. Awesome. Thanks for sharing that. And any ongoing treatments right now, anything like that? As we know, generally with TNBC, it's different from other breast cancers, so there wouldn't be, the hormone pill, for the most part. Of course, there is, research and clinical trials, and all this is continuously evolving. But for you, has there been any additional treatment since those treatments that you mentioned?
So I'm very blessed to say that I haven't had any treatment since 2019. So when I finished my first standard of care, chemotherapy and radiation, that was it.
Awesome.
Yeah. And it's been keeping me stable this whole time. So I mean, with metastatic, it is tricky because we know that sometimes it can stay dormant for quite a while, and sometimes it can flare back up again. And so right now, I'm just very blessed to have had 2 years of being stable with no progression.
Mm-hmm. Absolutely. And I know we've talked about, TNBC in general, as well as metastatic triple negative breast cancer. How do you have any suggestions for those specifically that are metastatic, or living day to day, and how you view being diagnosed with metastatic breast cancer?
The big thing is to take it day by day. Obviously, we all have really good days. Some days we have really poopy days where we're not feeling it. But I would just say understand your diagnosis. That's the big one. Really educate yourself about your diagnosis. Talk to your oncologist, and get the important information, not the Googled information. And the next thing is to live in the moment, because like I said, there are so many men and women out there living with metastatic breast cancer for way longer than what the statistics show. So that would be kind of my suggestion. And surround yourself with people that uplift you and support you and raise you up.
Awesome, definitely. And we just had a question about, can you share if you've changed your nutrition? So again, I just want to mention that, we're not, medical providers and not able to provide, the that advice or information specific, and everyone's, diagnosis may be a bit different. So definitely ask, your oncologist, and, if meeting with a nutritionist is something that's available. But Lisa, I'll let you speak to that, briefly, as far as nutrition and what your experience has been, and if you did change your diet.
Yeah, as far as my diet is concerned, I basically cut out the junk. Like, do I still have a treat? Yeah, everything in moderation, absolutely. I would say now my diet is more of a whole foods diet, veggies, fruit, proteins. I try and limit the amount of white starchy carbs that I have and high sugars.
Mm-hmm.
Although I do partake and enjoy it once in a while for sure.
Mm-hmm.
But everything in moderation.
Okay. And do you speak to your oncologist about this? Have you ever met with a nutritionist, or was that offered or available to you?
I actually didn't meet with a nutritionist, even though it was offered. I was
Okay.
pretty in tune with nutrition prior to my treatment, so I just continued on with what I knew, and then when I needed a little extra help, then I sought help for that. But
Definitely.
I load up on my vitamins to make
Mhm.
sure that, cancer aside, people should be taking their vitamins anyways, boosting up your system.
Mhm. Yeah. And throughout, your whole experience, what do you think has been most helpful to you? Is there something that, as in work that I do, we talk about like coping and what type
Yeah.
of coping techniques or mechanisms that you may use. But I just want to ask you, like, what has been helpful overall to you?
For me, it was finding the one thing that kind of grounded me. Sometimes you tend to spiral and you get super anxious and the anxiety is high.
Mm-hmm.
For me, I had to find something that could bring me back down.
Mm-hmm.
So for me, that was meditation,
Okay.
or really soft nature sounds, and just laying very still and quiet and doing breathing helped.
Mm-hmm.
And it was just enough to kind of give you that little snap out of it,
Mm-hmm.
stop. So every once in a while, we need that snap out of it, stop it.
Mm-hmm.
You're spiraling.
Yeah.
Let's get back to healthy thoughts and healthy mind. So I would say meditation was huge for me. The other thing that was huge for me, and I don't want it to sound tacky, but monetarily, I had friends and family do a GoFundMe when I was going through my journey. And I have to say, the GoFundMe took so much of the stress and the anxiety off, because I knew I was going to have so many treatments and all the driving and the
Mm-hmm.
cost that's associated with that.
Yeah.
I had another girlfriend throw an auction fundraiser. So don't be ashamed or
Mm-hmm.
embarrassed if your friends want to do that for you.
Right.
Accept it graciously, because you actually don't realize how much stress it takes off.
Mm-hmm.
It really lessens the burden financially.
Yeah, definitely. Before I mention that, someone just wrote, I am 78 and 12 and a half years NED with TNBC. Wow.
Yeah,
Thank you.
go. That's awesome.
Congratulations. Thank you for sharing. And back to what you were just speaking about, Lisa. Yeah, I mean that's so important to find, what works for you. Whether that's, meditation or, as you said, listening to certain sounds, like what's relaxing for you.
Mhm.
Definitely. And have you found connecting with other people diagnosed with TNBC to be helpful as well throughout?
Yes and no. The first people I connected with, not so helpful. They were more focused because it was an older group. I don't want to categorize age, but it was a little bit older group. So for those ladies, their life experiences were so much more than mine.
Mm-hmm.
Per se, that they kind of focused on the doom and gloom part of it. So I had to stay away from that group, and I associated myself with younger women in the same kind of situation.
Yeah.
And it was a lot more uplifting, because that's what we did. We boosted each other up when we needed it most.
Right. Yeah, and that's absolutely important. I think that it's so helpful to be able to connect with others and also to have this
Mhm.
amazing community. But it could be, people are going through different phases of life and
Yep.
being diagnosed. So kind of figuring out, what again, what works best for you, and what the type of people that you want to connect with, and moving forward. But to have that, I think, to have that support in a variety of ways. I know you mentioned that you have, a great support system, and that's amazing. And then to kind of have, like, this community as another source of, strength and support can be so important also.
It's so true, because there are times when you don't want to rely on your friends and family. You want to lessen a little bit of the mental burden on them a bit.
Mm-hmm.
So to talk to other men and women who have been affected by TNBC, who you can relate to, it sometimes can make the conversation a lot lighter.
Yeah.
Because they come from the same background. They don't tend to, pardon the expression, blow sunshine and you know where.
Mm-hmm. Okay, we do have a question. I just want to make sure we get it, catch it. So we do have a question about asking, do most women with TNBC undergo mastectomy? Is this, common for TNBC? Unfortunately, as I mentioned, we're not medical providers. We're not able to specifically answer that question, but based upon what we've talked about, and based upon what Lisa had mentioned, and Lisa, please correct me if I'm wrong, but being diagnosed with metastatic TNBC, that to have surgery was just not the standard of care at that point in time. It was going to the chemo and radiation.
That's correct. Because of the size of the tumor in my breast, and because it had metastasized, my oncologist wanted to focus more on whole body treatment versus just the breasts. Which, at first I was like, no, I want the mastectomy, because in your head, when you're first diagnosed, you're like, cut it out, take it out, whatever you need to do, just get it out of me. But after going through chemotherapy and radiation, it proved to neutralize the situation anyway.
Absolutely. And we have a comment here. Just sharing our breast cancer group, ages 23 to 86, all stages and kinds of breast cancer, and mentions newbies may be able to learn from others. The older individuals may mentor the younger, absolutely. And also those thriving with TNBC are really helpful to everyone, to the younger group, and and older, absolutely, to share that, definitely.
It's so true, because it's hard when you're first diagnosed to find people to relate to, and to find those outliers and those thrivers, and those are the stories that you're just so desperately seeking. And there are a lot of us out there, but on the same token, there's so many of us out there that are thriving great, and we don't let the cancer part be the main focus of our lives anymore. So those women and men, sometimes they kind of pull back a little bit from social media, because they do want to get on with life and not worry about the cancer so much. Me personally, I stay on my social media because I like to advocate. I want people to be aware that TNBC does not have an age restriction.
Yeah.
So
absolutely. Yeah. Definitely. And I know throughout the conversation, it's come up a little bit, but just as far as, your identity as a person and being diagnosed with cancer, how do you think that, impacted your identity? I know, some people would rather, not include, the cancer diagnosis in their identity moving forward. What are your thoughts about that?
If people ask, I'm an open book. I don't, if I meet people, I don't go around and say, hi, my name's Lisa. I'm a stage 4 thriver.
Yeah.
It's not something I divulge right off the hop, but if people want to talk about my diagnosis, I'm absolutely an open book because I want to help educate and share the experiences I've gone through if it can prevent someone else from having to go through those said experiences.
Absolutely. Yeah, so important. And I think that, that's, the reason, maybe a lot of people are, want to be connected, learning from others, but also, sharing the experience. I went through this challenge, or I had this obstacle, this is what I did, and offering these suggestions, within the community. Definitely.
Absolutely. And because each cancer institution is different, it's great to bounce off other patients because sometimes you can hear about trials coming up that you had no idea about. So it is really awesome to surround yourself with a really great cancer community. Just for those reasons alone, because maybe your particular institution, for instance, I'm in Canada, so I don't have access to some of the same drugs, for instance, that you have in the US.
Okay, yeah, absolutely. And did you ever have the, sorry, one question came in before I asked my question. How many years out do most wait before calling themselves a survivor? I think that's really dependent. Yeah. What do you think, Lisa?
I think it's individualized. I don't necessarily refer to myself as a survivor, more as a thriver because I'm living with it. If I was an early stage cancer and I beat it and there was no evidence of disease in my body, I could say, yeah, I'm a survivor. I survived cancer. I beat its butt. I still beat its butt,
yes.
but it's sleeping and I'm thriving. So I think it just depends on the person what they want to identify with.
Yeah, absolutely. No, I think that's a great point. I think it is, very, person to person, very individualized, and it may depend on, the stage of diagnosis, or, there may be people that are, living, with cancer and identify as a cancer survivor and living with it, as well as, thriver, as you mentioned. Yeah, absolutely.
Some people like to call themselves a warrior. Every once in a while, I throw that one out there. I'm a cancer warrior.
Absolutely. Yes, definitely. And you had mentioned something about trials. So I know that, again, we're not medical professionals, but I'm just wondering, did the conversation about clinical trials come up for you? And how did you find that information, or, any conversation of clinical trial for you?
For me, my particular institution is a learning hospital. So they do trials there. I was part of a brain MRI trial. So they basically just wanted to follow with either scans or just regular follow-up without the scan to see in stage 4 women, how many metastasized to the brain within a year's time. So I was on a year's trial for that. But as far as trials in medicine is concerned, right at this point, I don't require it. But my oncologist has been quite clear that they do have trials if it's needed.
Yeah, absolutely. Yeah, and if, there are a lot of, wonderful resources for clinical trials as well. The Triple Negative Breast Cancer Foundation has a clinical trial matching service as well. So if anyone, is looking for more information, definitely. We've had a couple of questions come in. One, I'm almost scared to jinx since I'm only entering my 2nd year. Is this normal? Entering, possibly a 2nd year of either, maybe diagnosis or maybe since treatment, not sure. But Lisa, do you have anything to share about that? If someone's entering in the 2nd year of maybe experience overall?
Yeah, I mean, going into my 2nd year, I was calmer.
It was post chemo. She just said so. Post chemo. Okay. 2nd year post chemo. Yes.
Yeah. the second year post chemo is actually hard because when you're in active treatment, mentally for me, I was like, yeah, I'm getting the juice, it's killing the cancer, you know? And then when you're done your treatment, it's kind of like, you feel like that backbone has been taken away. And all of a sudden for me, I spiraled a bit after treatment was done because I thought, well, what's taking care of me? What's killing the cancer?
You know, what are the next steps? You know, what now? It's a
Right.
lot of like post-treatment concerns.
Right, right. So for me, my opinion was to, and my suggestion was to seek a counselor for that, because there's a lot of positivity with being out of treatment, and we tend to focus on the what ifs and the negative part. So I would say get yourself a really great counselor. A lot of cancer institutions, like obviously Lauren should know, have their counselors right on site. So super helpful.
Absolutely. Yeah. And, you know, just to add, you know, by calling the TNBC helpline, it's, you know, in partnership with CancerCare, we can help, you know, find resources for support services. We're oncology social workers and can help offer that individualized support as well. So there is support out there. So definitely that's such a great point, Lisa. And another question, do people get the same job opportunities after cancer?
I've been lucky that my employer has kept in contact with me the entire time. I'm not actually back to work yet. Between a cancer diagnosis and a global pandemic, it makes it hard for the immunocompromised. But you know what? You can't be discriminated against for having a stage 4 diagnosis. So, I mean, challenge it if you are, but go into a career or a job that makes you happy, not that just makes you money. Because it's a big difference after a cancer diagnosis when you're going to a workplace and you're like, oh, at the end of the day, and you're pulling your hair and you're like, geez, I hate this place.
That additional layer of stress.
You just don't need it. So find a job or a workplace that supports you, that knows about your diagnosis. And then when you come home at the end of the day, you're like, I did a good job. You left the job where it was at work and you continued on with your home life with your family.
Yeah. Definitely. You know, I think that's, you know, something that does come up, you know, returning to the workplace, you know, what that looks like. You know, definitely, you know, if you're currently working and being diagnosed, you know, there are resources available. Please feel free to give us a call, and we can help with some of those resources. But just, you know, speaking to your employer, employment rights, you know, all of that, definitely to have that conversation. And then returning back to work, you know, there are a lot of, you know, you may have a lot of concerns, or maybe, you know, you might have, you know, taken time off due to treatment, and now, you know, returning while managing, you know, post-treatment concerns and, you know, all of that. So yeah, definitely, you know, seeking that additional support, you know, there, you know, you may be able to, you know, also receive some type of, you know, a financial, you know, assistance, or, you know, it depends what route you want to go. I think that it is very individualized, but if in checking with your doctor and making sure, you know, returning back to work is a good fit for you. But you know, it can be possible. Yeah.
Absolutely. I know a lot of my community was stage 4 and they've gone back to work. They're successful in it.
Yeah.
Like I said, I've been in correspondence with my employer, and they have been phenomenal. You know, I don't know how many times they've had to reiterate that we understand that you're going to have appointments. We understand you're going to have scans. We understand you're going to have time off, and that your health is first and foremost.
Oh, that's amazing. That's even another source of awesome support to have, and to have that connection with the employer. So important. Okay.
For sure.
Well, great. I know that we're kind of it's been about 50 minutes or so, so we'll start winding down a little bit. But before I do so, Lisa, anything else that you would like to share? Anything that we didn't cover? Anything whatsoever? And also, if anyone has any questions, comments, please throw that in the comment box too.
For sure. Going forward, I would say, again, just to reiterate, stay off Dr. Google. I was warned about it when I was first diagnosed. I did not take the warning. I went on Dr. Google, and of course, I spiraled down the rabbit hole. So don't do that to yourself. Always seek professional opinion, people that are credited with a medical background, and stay off Dr. Google. It's not good for your mental health.
Yeah, great point. Okay, awesome. Thank you. Thank you, Lisa. And I think we'll wrap up there. And it's been so great speaking with you and being able to especially have this conversation on the Triple Negative Breast Cancer Day. And all in all, we are just so glad we're able to do this together. So I just want to say, Lisa, a huge shout out to you for joining, and it's been awesome speaking with you. And then thank you to everyone who's joined, watched, and participated, and we'll also be saving this video too, so that we can share it with our communities too.
Absolutely. Thank you for having me and taking the time to bring such an important subject to the forefront today.
Absolutely. Thanks, Lisa. Take care, and
Take care.
we'll log off now. All right. Thanks.
Bye now.
Bye.